Since 6 in a flu virus that could be pouncing on your pet. The night team's Maria Guerrero has the story and whether you should be concerned. Maria?
Well, Eric, there is a form of dog flu that, while it's similar to a seasonal infection going around right now, there are differences to look out for. We're on your side tonight with a virus that is not yet in Wisconsin, but will be only a matter of time before it makes an appearance.
That's it. That's a good boy.
When Mike Sawyer picked up his dog from the kennel, he noticed Baxter wasn't his usual self.
Very active, rambunctious. He's 11 months old, so very inquisitive into everything, and he wasn't really moving off his bed.
That's why Sawyer brought his English Mastiff to the vet.
Has it been getting progressively better or worse since?
I think it's worse.
He's wondering if Baxter came down with an illness common in humans.
Sneezing, coughing, not very active. His appetite was way down. He kind of has the symptoms of a maybe not with the vomiting, but the symptoms of the flu.
Influenza in dogs, for the most part, is going to be a fairly mild disease.
UW veterinarian Sandy Sawchuk says canine influenza, or H3N8, is neither new nor did it originate in swine.
It was a horse virus, but it jumped species. And we know that this first occurred probably back in 2004, 2005.
Sawchuk says while respiratory infections are common this time of the year, there are symptoms that set H3N8 apart.
They usually have nasal discharge, just like us having, when we have the flu, we may get a runny nose, a fairly high fever, as well as coughing.
Unlike the H1N1 vaccine, there is plenty of H3N8 vaccine available. But because there are no confirmed cases in Wisconsin and outbreaks only in Florida, Denver, and coastal cities in the South, not every dog needs a vaccination.
Owners are traveling with their pets, especially over the holiday season, to some of the southern states. They may want to consider having their pet vaccinated, especially if they are going to be around other dogs.
I never knew dogs could get the flu.
While Baxter doesn't have the flu, he's definitely under the weather. All he needs is a little rest and maybe some treats.
Good boy. Good boy. Good boy, Jacob. Yeah, gentle.
The vaccine average is about $30. It is 2 doses taken 2 weeks apart, and it takes 2 weeks after the second vaccine for your dog to be immune. So Dr. Sawchuk advises that if you you call your vet at least 1 month before you travel. You're scheduled for your vaccination, especially if you're traveling to the South. And if your dog is vaccinated for kennel cough, that is a completely separate vaccine from the one that we're talking about for H3N8.
And just like H1N1 with people, some dogs more affected by this than others, right?
Some dogs, exactly. Older dogs with underlying health problems that start showing these symptoms. These are runny nose, high fever, and coughing. They could have H3N8, which could lead to pneumonia and even death. And one more thing to keep in mind, H3N8 is transmitted from dog to dog, not dog to human.
All right, it's good. Baxter did a good job for you there.
He did.
He didn't act up in front of the cameras.
No,
there.
he did not.